Buenas tardes, estamos en la inauguración de las oficinas del Brian Holden Vision Institute en Colombia. We are here with Kovin Naidoo. He is an optometrist, a public health leader worldwide who fight against blindness all over the world, which is fantastic. So welcome.
Thank you.
To Visión y Óptica and 2020 magazine.
Thank you very much.
Okay, please explain to us the global vision, the global mission of the Brian Holden Institute, specifically in public health.
There are about, you want to hold that? Okay. There are about 640 million people in the world who don't have a pair of glasses because they can't get access to an eye exam, or they cannot get access to afford a pair of spectacles. This costs our world economy close to $269 billion. And if you look at it in terms of children especially, it pushes them further into poverty, or it keeps them into poverty because they can't get an education, and vision is so central to education. There are adults in the developing world who give up their jobs because they can't read, if they have a clerical work, or some people can't drive, so it keeps them in unemployment, or it pushes them into unemployment. And most importantly, I think, anyone with vision impairment has a reduced quality of life. So that's really what the Brian Holden Vision Institute wants to address, is to ensure that people have access to eye exams and spectacles, and affordable spectacles.
Okay, which are the principal new advances or technologies that are you developing for these missions?
Okay. We focus on public health interventions, but we have quite a big research component to our organization. It started off many years ago as a contact lens research division, and we realized that contact lenses cannot meet people's needs, especially when people don't have running water, etc. So we developed public health interventions, but we still continued the contact lens development. And now, if we look at it, myopia or short-sightedness is one of the leading causes of monocular blindness, meaning blindness in one eye, across the world. And this, what is happening is that it's becoming a pandemic. It's increasing significantly because our children are spending more time reading at near, because if they're not reading, they're on the mobile phones, the iPad, all of those things. So myopia is becoming a bigger problem. So the myopia is progressing at an alarming rate in our society. So in that respect, we have developed spectacle lenses as well as contact lenses that can slow down the progression of myopia. We have also developed, our researchers have developed contact lenses now that assist the process of reading. So adults, for example, who have been wearing contact lenses now find that after 40 they can't read at near. We've developed contact lenses that are helping them to read. Now that concept is not new, but the technology that we've developed around the contact lenses for reading is better optics, it's much easier to fit, and that's new technology. So we're trying to make it not only develop new technology, but make sure that this new technology is affordable. There's another area which is very important. Diabetes in our world is growing at an alarming rate, and as a result we have now developed a camera to photograph the back of the eye and to be able to help optometrists and other practitioners to very quickly and easily diagnose diabetic changes in your eye. We hope that eventually the technology will be so cheap and so accessible that even primary healthcare clinics, a nurse can take a picture and send the picture to somebody who would say, okay, call that patient in. Because most of the patients that we as optometrists or ophthalmologists are seeing in our practices are patients who are already going blind. And so these are some of the technological innovations that we are investing quite heavily in.
That's really good.
Thank you.
Let's talk about Latin America. What was the motivation to start all over this region? Or what are the needs that you notice here?
Well, our focus is the developing world, and one of the things we had done was we started in different parts of the world, and we said, well, we'll get to Latin America when our resources allow. But then we had recruited optometrists from Colombia to come to Mozambique in Africa. I mean, I live in South Africa, and we decided to set up a school of optometry in Mozambique, and Vivian Ocampo came and worked there and ran that school of optometry and made a very significant contribution. For the first time in history, Mozambique graduated optometrists. The country has never had optometrists being trained in the country. And so one of the things that struck me was there was all these people returning home, and in their own countries there were challenges, and in their own continent there were challenges, and maybe we should do something about it. So we decided to set up our office here, and have recruited those optometrists, some of them at least, who have worked with us before, to become part of the process. Yeah. We were also approached by the optometrists in Latin America prior to that, who said, look, Latin America, while Colombia, for example, has a lot of optometrists, there are other parts of Africa, Latin America, that does not have enough optometrists. The needs are still there. We need to get involved, and the evidence was very clear that there were lots of people in Latin America who were facing problems with visual impairment and blindness due to uncorrected refractive error as well.
I think that this question is related to that you have said something about it, but which are the main objectives here in this region?
Okay, so I think as an organization, we do various things. We set up schools of optometry to develop the human resources. We go and set up eye clinics, and usually in partnership with governments, so that we can reach the poorest of the poor who go to public hospitals. But we also partner with other NGOs and set up eye clinics in those situations as well. And then we do research, and now more recently, we are now setting up what we're calling a social franchise, where we're supporting young optometrists to set up clinics in underserved areas. Because we believe that when you look at society, you can't treat society as one. There are people right at the bottom, the poorest of the poor, that needs government to support them. But there are some people who have some resources and are willing to support an optometrist who's working in an underserved area. And so we're saying, let's encourage that entrepreneurship as well, as long as it's done within a context of affordability and quality. So those are all the things we do. So when we looked at Latin America, it became very clear to us that the biggest need here was to support the education and training. So we're investing quite heavily now in optometry training and development. And also in Latin America, there's quite a shortage of research data to guide governments, to guide non-governmental organizations, and even the professions as to what interventions need to happen. So our first wave priority is around that. And obviously, as that develops and we identify areas where the social franchise model or the setting up of vision centers or eye clinics need to happen, we will engage in that. And a lot of that is dependent on the resources that we have, if we don't have the appropriate financial and other resources, then we will consider that as the next phase of what we do.